Okay, welcome. We are the Note Ninjas. I'm Stephanie, the physical therapist, and Nicole, who is not here right now, is the occupational therapist. And together, we teach physical and occupational therapists new treatment ideas and how to document it. But today, I just want to go over something about using evidence. So, in our documentation, it's very important that we show our skill. If we want to get reimbursed for our services, we have to support why we have to be there. And that's really based on medical necessity and what we are doing that a lay person would not know how to do. And one of the things that we can do is add evidence and research into our documentation. And this is even more important when you're billing for things that could get denied a lot. One of the things that we do get denied a lot is neuromuscular read, especially if you're billing it more frequently. If you're seeing a lot of Parkinson's or neuro patients and you are billing it more often, you should have research supporting it. And it is not difficult to do. Sometimes we get nervous. There's so much out there. Had to read through all the articles. How do we know if they're good? Our suggestion is with the population you see the most, keep a list of research that you found supporting your most frequent treatments. Keep a list of the research, a link, exercises that are supported by that research, and examples of documentation. So here is our list. This is just a basic reference guide that really helps you put your evidence into your documentation. So first of all, as we see, it's important for our evidence-based research. It helps strengthen our documentation, and we can keep track of it. So, what we would do is we would have the evidence-based research article. We would have the reference right up there for everything that we see. If we do a lot, like I said, if we do a lot of neuro, we should definitely have some references to specific interventions that we could do to really support our neuro patients, our Parkinson's patients, stroke patients. Underneath that, you would have a list of the interventions or activities that support that research. And then you can have an example of your documentation. So this is how you can write it simply. According to the article titled, put the title, the author, and the date, patient performed what kind of activities. Therefore, performed that intervention and that skill. It's very simple. It shows your support. You can copy and paste the basics into your note once you've already done the work. And it really helps support our services, helps make sure our patients get the best treatment, helps make sure you get reimbursed. Plus, it really shows the insurance companies that we know what works for these patients, and physical therapy is what they need to succeed. So I hope this helped. Make sure to follow us at the Note Ninjas for more treatment ideas and documentation tips.